The University of New England is a regional university based in Armidale, New South Wales, offering over 200 undergraduate and postgraduate courses. UNE has more than 20,000 current students and 1,200 staff. The university's School of Health and English Centre collaborated in 2017 to develop an English for Nursing program based on OET.
The courses we offer are an undergraduate bachelor's degree in nursing, a master's degree. We have also a range of other postgraduate courses for registered nurses to come and do. The graduate entry master's program that we offer is predominantly undertaken by international students. It's between 1.5 years and 3 years in length, so students can elect to fast track or do the course quicker. We require students to do about 800 hours of clinical practice. They also do 18 units, so in effect they get the first year of the Bachelor's of Nursing equivalent course off.
The Philippines, Nepal, Korea, Africa, China, absolutely fabulous mix. And some of them come with a health degree background, but a lot of them come with a wealth of experience. Basically an 8-week program, and then they have a week of where they do simulation and they have assessment, and then they will go on a 4-week placement.
In the past, the School of Health have seen the effect of English language skills in the feedback from hospitals, where students spent their clinical placements at the end of the first trimester.
When I first arrived in Australia, I find it very difficult to understand the accent of English.
I think one of the challenges is how will I know what to say? Is that I lack of phrases, expressions, and how will I deal with the person?
The main challenges was the people are using the slang words and they're speaking too fast, and the intonations. I find it hard to understand them because they are too fast.
Some patients are very irritated, some are very cooperative. So we have to talk to them in a polite manner and make them calm down and make them understood what we are saying.
Some communication issues were due to cultural differences, but also lack of confidence in their English skills, to show empathy or be reassuring, for example.
We surveyed 90 students. We asked them what they felt were their weaknesses, their biggest weaknesses. And we asked them what difficulties they'd had on prac and which areas they feel they would appreciate the most assistance in. When we were developing the EFN course, we looked at the OET preparation materials, and using the criteria that's used in assessing the speaking subtest, we looked at how we could fit that in along the way. The students receive 44 hours of face-to-face English language support, and they also have an online component so that they can access anytime.
A typical lesson will have 2 parts. In the first part, we'll talk about the writing aspect of the English language, or sometimes we'll focus on reading. But in the second part, we always focus on communicative skills, listening and speaking. So in the second part, probably we'll introduce the theme. After that, we'll listen to some conversations between some nurses and their patients. The themes include diabetes, nursing handovers. We talked about IV cannulas, pre-operation and post-operation care. We give feedback to the students on pronunciation, intonation, the use of vocabulary, and more complex aspects of English communication.
I just learned to be more polite to the patients.
Some of the pronunciations are different that we used to pronounce in our country than here in Australia.
We have all the steps what nursing to have to do, so it's very useful.
What we communicate in our country is according to our culture, but here it's different. It's cultural difference country-wise.
Mark Cooper, director of the English Centre, asked teachers Jess and Goldie's son to develop a course that will provide regular English language development to students during their first trimester of the Masters of Nursing course.
I've been really quite excited about this project since it first started. The Language Centre teaches overseas students in English for entry into university. And this is the first time we've been able to branch out of that core program provision into a program that assists students once they've entered university. So it's really exciting for our teachers to be involved in the ongoing education of students at UNE rather than just before they enter the university. It's a program that not only introduces the students to the English language and context, but it also allows them to practice using that English in a very non-threatening situation, so they can actually use it, hopefully use it well when they get into the situation they're going to need it. I think the English for Nursing model as a program for support of nursing students is a really good mix. I think it's a good fit.
The English for Nursing program was not compulsory, but most of the international students who attended the first lesson have returned every week. And following the clinical simulation exercise, feedback was very positive.
The simulations were a lot easier for the students than they have been in past cohorts who haven't had this kind of experience, this kind of support.
When you see the students coming every week to every lesson, it has been very positive.
They've certainly had a much stronger preparation. We are bringing them back to do a debrief with them about their prac experience.
This cohort of students will deal with their English language skills on clinical placement much better.
I think OET is a good opportunity for nursing students.
We know that it's about our career, our professional. I think much easier than the general test.
I notice little things, like they're getting, they'll get a joke or they'll get an expression.
It was very easy for us to integrate OET with English for Nursing. They were very compatible.
It's the most exciting thing that's happened, I think, for a long time for the Language Centre and teachers.